Hey folks, welcome to the Salty Seaman. Another tips from the fleet. Just got on a little jag talking about medical and dental while my time in the service. Felt it would be a good topic to talk about here. Talk a little bit about my experiences, what to expect for those who are coming in, and maybe have fears about such things. And you've probably heard some stories. And those who are new in, even those who, been around and, dealt with it a lot of times, it is definitely, its own unique beast, I find. I think one of the first things you're going to find is, it's, if you're a person who really doesn't like going to the dentist, doesn't like going to the doctor, you're not going to have a choice in the service. It's, at least yearly, or you should at least yearly be, kind of almost you are pretty much forced to go get your checkups. Like it's part of the deal. You can't just, slack it off and, maybe you can try, maybe you'll get lucky if you're just one of those people who just doesn't like doing that thing. I know my first, tour, I think I got out of a lot of them, and it was a little less, it was a little less tracked as well. Like sometimes you just, I think I avoided a lot of yearly checkups. I don't either they weren't really pushing it, or they just kind of let it go, and I just never got around to it. But after that, it was pretty much like every year you're getting something done to you just on the regular. Like you got to get this checkup, you got to get your blood work done, you got to get your shots. And they're going to, treat you, it's a thing you just, have to maybe not look forward to, but every year, you got to do what they call something they instituted a few years after I came in, birth month recall. Basically, the month you're born in, you're due for your medicals. A lot of times that is updating shots. You get your basic blood pressure and whatever else checked out. If you have any other issues, you can go on to further getting, those things checked out, taken care of. And with dental, same thing. It's like you're going to get, once a year, they're going to x-ray your teeth. They're going to see if there's any issues they got to deal with. And then you got to do a follow-up appointment at least to get a cleaning. And that's, at least once a year. And if you're a person who's really, into, we'll stick on dental here for a second, I find this one, much as one might want to, kind of slack off on, the military's not going to let you do that. And it's a thing. But if you're a person who's really big on your dental health, if you can do it twice a year and like they have no problem with that. And of course, going in on regular, when things do come up, it's like, hey, I chipped a tooth, I need to go in. Like, hey, I think my, this and that. But on dental, I think one of the things to know, and especially if you're looking to avoid certain things, and this is, kind of an old military trick, is, getting a dental appointment. I think it's become one of those things because dental is kind of viewed as untouchable. For whatever reason, for operational readiness, that has become one of the high points. And I think because for a long time, I think it was overlooked, and you end up with people in on deployment in bad situations, where they're, something, it's one of those things no one thinks about. It's like, yeah, you rolled an ankle, you did this or that. There's always medical, but people for a long time, I don't think really paid attention to, the dental aspect of it, and people would get, really bad problems, you'd be in a situation where it's not as easy to fix. So, if you have an appointment for dental, no one's going to tell you, even Marine infantry, who are kind of the worst of, hey, fuck you, you can't do that because, well, fuck you, which is kind of their MO on a lot of that stuff. They don't mess with dental. You have a dental appointment. You not only, your command's not going to be able to say, no, we need you to do this or that and this, X, Y, and Z. it's like, that's sacred. It's like you go make your appointment. And that's the other part. Like, you better make that goddamn appointment, because also that could go back to landing on you. And sticking with that, obviously, if you're going through boot camp and you have dental issues going in, a lot of times they're going to fix a lot of that in boot camp, which is also, and a part of that I think is, if you have no problems being in the chair and getting work done, and it's probably not going to even be up to you anyway, especially in boot camp. I mean, you're going to do what you're told, without question. It's, you get a lot of work done there. Quality, I think that at that point, that's something you got to worry about. My dad came in 1953 or 54, and he had some bad teeth. He was from the backwoods of West Virginia, and instead of, trying to repair or save anything, they just decided to rip them all out. And he had dentures since he was 17 for his entire life. There's always horror stories of that with the military. Again, that was the 50s. It's definitely better than it was then, but there's still, you'll hear stories from people, what horrific things were done to them, dental wise in boot camp. On the other hand, you hear stories of, hey, I got, they pulled my wisdom teeth out and I got like 2 days of SIQ, which means, while your division's off doing whatever or getting beat down in front of you, you get to lie in your rack, because they can't mess with you when you're on a dental SIQ. Like I said, dental stuff is sacred, and that will fall into the fleet or the field, and then a lot of people, use that to their advantage. They know there's something coming up that, they do not want to do, some field exercise or whatever, and they'll schedule, appointment to get whatever they need to get done to their teeth around that time. And it's just one of those things where they just can't do anything about it, and it's kind of funny. And it's almost like an in-joke in the service, it's like, oh, you got dental? Well, better go. Don't miss it. And you better not, as I said before. In terms of quality, it's like, I think maybe comparable to the civilian side. I never had a lot of problem. I've had all 4 of my wisdom teeth pulled out while I was in. The first one was the absolute worst. It was one of my lowers, and it was the one that was actually giving the most problems, because like a lot of people's wisdom teeth, they come in weird and crooked, and I just kept having problems with certain things getting caught in between. Like there was a gap between the gum line and the wisdom tooth on my lower left. I think at one point we were eating popcorn on my first ship, and I got some kernels down there, and it like gave me, some of the nastiest pain in my life. I onboard dental managed to dig it out, and it sucked. They give you the Novocaine shots, and, the dental technicians at the time, DTs, now they're all corpsmen, I don't think did a very good job of, shooting me up with Novocaine. It really hurt, and they were digging around there for a long time. And then we pulled back in after deployment, and then I got sent off to get it pulled. And same thing, they were just yanking and pulling with felt like a pair of friggin' rusty pliers. All I had was localized Novocaine, and it sucked. It was a lot of, there's an intense amount of pressure, some pain, even though you got the Novocaine, some pain, and it just took them forever to get the goddamn thing out. That one really sucked, and my, medication was Tylenol 3. It wasn't anything, good or fun. But it got through it. Second time, both my uppers pulled out. I think I was at that point I was getting out of something. I don't remember what it was. It was pretty late. Same ship. I was on the Blue Ridge real late in my time there. But, I decided to make the appointment to get the top 2 wisdoms pulled out. And, I got a full bird Navy dental captain and didn't notice it. Like, it was same thing. It was localized Novocaine. The shots weren't too bad. And I thought the guy was still prepping, because I just remembered the last time I had a tooth pulled, I had, all the pain and pressure of them just trying to yank the bitch out. And then this, that guy, the next thing I know, he's showing them to me in his hand, like, hey, here you go, they're done. And I thought he was still prepping. Like, he was so good, like just a smooth friggin' operator, and I really appreciated that. And I still got, I got my SIQ and, whatever I was trying to get the hell out of, I can't, lost the time, whatever that was. And I finally got my fourth one pulled, basically 10 years later, just like, before this starts becoming a problem, I should finally get this thing out. And, I was at Millington, Tennessee at the time, which didn't have on base. So they sent me out in town. They put me under. It's the only time I've ever been put under. It's a very weird experience. Just like I'm squeezing the ball at one point, and then I'm waking up, they're showing me my tooth, vague kind of woozy memories of, my coworker drove me to my house and, I went to bed, and otherwise I don't remember a lot of it. And I think in that case, I think they gave me something a little bit better than, Tylenol 3 or whatever. And, other than that, you have your, like I said, you get cleanings every year, which is, I think it's one of those definitely things people slack off on in the civilian world versus the military, where you're going to get it every year, and it's a good thing. As a person who's definitely slacked off on his dental, because of all this, is like, yeah, I just made my appointment for, get my dental checkup and cleaning coming up. It is something that it keeps you on the ball with that. And because as a rule, dental is just one of those things people just kind of don't want to do. And I think there's some kind of weird thing about, people digging around in your mouth and, when you got to get fillings, which I've had a couple, they're literally drilling into your skull. And, the whole thing just, it just really freaks people out. I personally wasn't freaked out so much. But I recognize just like, it's not comfortable. It's not fun. Feels like they have a billion things jammed in your mouth. I have an overactive saliva gland under my tongue, and it's a squirter. It just is, I have that thing where, I end up just, squirting saliva on people in the dentist chair. And, I always try to warn them ahead of time if I'm in that situation, it's probably going to do that. But, overall for me personally, I didn't have a lot of problems with dental. I said, it's, get the work done, it's free. I think they're definitely a lot better quality than it used to be for those people who are scared, the military's going to screw up my teeth. But at the same time, it's something you should, if you're feeling problems, you should go, not something you should put off. But, that's dental. And, medical's another thing. It's another one, there's a lot of complaints. There's all these jokes, you go there and you're sick. Oftentimes, you're not even going to see a doctor. You're going to end up seeing a corpsman. And for the most part, they're going to give you, something simple. The joke is always like, change your socks, stay hydrated, and take Motrin for whatever ails you. And if, you got a really bad cold, they're going to give you, a pack of medicine, same stuff you'd get over the counter, basically. And they're going to send you back to work. And I never seen that much change, especially wherever you go. Like, you basically have to be near death to get sick in quarters, SIQ as they call it. I don't think I explained that earlier for those who don't know. But essentially, like, yeah, you're not fit to work because you are sick. So you get to stay in your barracks, stay in your, sometimes your house, on the ship, in your rack, whatever. But they really do, I believe they're trained like, we don't just do that, give that out to anybody. It's the military. We have shit to do. You got a cold, suck it up. And unfortunately, in that case, sometimes it's like they do overlook things that are really bad, like pneumonia and, fluid on the lungs. And they just think you got a cold and you're being a little whiny bitch trying to get out of work. I think that's, that was definitely happening the entire time I was in. I don't think that's probably changed much, and definitely depending on who you're working for and where you're working, how much that's going to affect you, as well as, actual injuries. Sometimes, getting a light and limited, you rolled your ankle, twisted your knee, stuff like that. Sometimes, again, it can be difficult to get anything done about it because, they're always under the mentality of, some people are coming there to get out of, work or exercise or deployment or whatever, especially when you're still going into like, getting on that topic. I had a boss on my first ship. It was a first class. I was a E3-4. And he was just determined not to be there, I think I've talked about this guy before on a couple of my tales from the fleet, but he was always trying to get off of sea duty. He was close to the end of his career and he didn't want to be there. And they pretty much forced him to go to the ship. So he was constantly in medical trying to get something. And, when you're at that, rank level, I think you have a little more leeway. And it was just, he was constantly going in for his shoulder or his back. That's what I always heard. And then I think he finally did get off on for a little while. But you could definitely tell they were so fed up with him. He ended up going back pretty quick. But he went on his knee was the point. I'd never heard him once complain about his knees. He was a heavy set guy, late 30s. Otherwise ran, I think he ran like an Ironman PT, surprisingly. You wouldn't look at him and tell. But the funny thing is I never heard him talk about his knees. It was always his shoulders and his back. And all of a sudden, like, oh, I'm out for knee surgery. But they still brought him back, which is hilarious. He was like hoping to ride that out, I think, till retirement, but it did not work for him, alas. But that's, if you really have issues, I think, important advice on that one is to, fight over what you believe. You think it's really screwed up. Don't just take a corpsman's words as like, yeah, you tweaked your knee a bit, you tweaked your ankle a little bit, go back to work. Or man, you just got a cold, quit being a little bitch. If you feel it's more than that, don't just take them at their word. Just say, hey, let me see someone else. I don't this is not true. I don't believe you. And I think a lot of people don't do that because, military wise, you're kind of institutionalized, and someone in a position of authority tells you something, you just kind of take it. And, and I've seen people get really, really sick because a corpsman didn't know what they were looking at or what they were really doing. And just trying to get on to the next patient. And, you had a really, really sick person there with a flu or a pneumonia or, what have you, and then end up falling out in the middle of work or somewhere else bad. And, I've seen people nearly die. People end up in comas. People end up, getting, weeks in the hospital over this crap. And because that's just, it's the system, it's the process. And there's a lot of guys, they got to treat, and they just don't have a lot of sympathy for you. And a lot of times, not a lot of bedside manner. You can get lucky depending on where you are and, the command you're at. It's not a deployable command. It's, pretty easy, laid back. Generally, a lot easier on that stuff. I've been sent home on different shore duties just for having a cold because they didn't want me spreading it around. The ship was always different. It was like, they on an aircraft carrier where I had one of the better chain of commands I ever had. I had issues like that. I called in one day with food poisoning and they didn't make me drive in and go see the doc or anything like that. It's just like, hey, it's coming out both ends. Me and my wife both got it. My boss is just, the great Chief Terry Redden, now retired Senior Chief Terry Redden, just told me to stay home. Do not come in here. Do not spread the, she didn't want me crapping everywhere, she's common sense, but you're not always going to get that. So you sometimes you do have to make that, got to make that trip to medical, and if they're not listening to you and you think they're underselling what you got, it's very, very important, I think, to make sure you go try to see someone else. You raise a stink. A lot of people don't want to do that, and they just, they're just going to cow down and go back, and it's not the way to do it if you really, really think something's wrong with you. Other things on the medical tip, there's tons of stuff you can get done too. There's people have gotten plastic surgery, boob jobs, what have you, LASIK. A lot of optional surgery you can get done. Usually with reservists, the plastic surgeon world and stuff, and other eye surgery and things. So, it's good to, those are usually waiting lists and it depends on where you're stationed. But, I think those are good things to get done and taken care of, as part of your rights and your privileges as being a military member. And I think, I wish I'd done LASIK when I was in. I kept putting it off. Maybe something I'll still do. Luckily I'm retired and have TRICARE. But that's just it. Just a little primer about medical and dental. Hope it was fun for new people coming in or just joined, and maybe a little trip down memory lane for some of you vets of the services. And that's pretty much all the Salty Seaman's got for now. And I'll talk to you freaks later. Peace.